Thank you so much, Dr. Marissa Salazar, for joining me today. I really appreciate you taking the time to speak with us and answer some of our questions regarding autism and autism spectrum disorder. So thank you so much for being here. A little bit about Dr. Salazar. Dr. Marissa Salazar is an autism disorder specialist with the UCF Center for Autism and Related Disabilities. For those unfamiliar, CARD is a free program funded by Florida's Department of Education that provides education and technical assistance for individuals with autism spectrum disorders, their families, and the professionals who support them. Dr. Salazar earned her PhD in Exceptional Student Education from the University of Central Florida in August 2011. Her research has been published in peer-reviewed scientific journals focusing on early intervention for children with ASD and collaborative planning between preschool teachers and parents to meet the needs of young children with autism. She has a Hispanic background, is bilingual, and is passionate about building cultural competence while working with families and children who are dual language learners. Dr. Salazar has extensive experience in early childhood development and applied behavioral analysis. Additionally, she prepares future educators as an adjunct professor for UCF's College of Education. Again, thank you so much for joining us today, Dr. Salazar.
It's my pleasure. Thanks for having me.
Very good. So the first question I have for you is, what is autism and what causes it?
So autism is a developmental neurological disability. There's really currently no known cause. We do have agreement that there's some impact of genetics and some interaction with environment, but there's not a specific known cause as of yet. Autism, as I mentioned, it's a neurological disability that impacts the way that we interact with others and our environment. It's typically characterized by some differences in both social communication and what is described as restricted, repetitive, and stereotyped patterns of interests and behaviors. We'll kind of get into some examples with some of your other questions.
Absolutely, absolutely. What are some things that a parent should look for as potential signs of ASD, autism spectrum disorder?
Yeah, so I think it's important to note that no single symptom or behavior is sufficient to determine whether somebody has autism spectrum disorder or not. But a lot of times parents do recognize some differences or those red flags that might lead to additional screening or evaluation. And so some common things that parents will report might include just general delay in language development. So thinking about maybe a 2-year-old who isn't talking yet. In addition to spoken language, we might see some differences in nonverbal communication. Usually, we would expect that by 15 months of age, a child would have about 15 gestures. So that's thinking about kind of social communication milestones. So when we have a child who, by that 2-year-old mark, isn't really talking yet, and we're also not seeing those gestures like clapping or waving hello or reaching when they want up or pointing when they want to direct your attention to something, those can be some additional red flags. Parents will also often share that they see some unusual or different behaviors, uncommon kinds of behaviors that might be really repetitive, like rocking, hand flapping, lining up objects, or utilizing toys in kind of non-functional ways.
Okay, great. And you kind of answered this question a little bit with your previous one, but if a child is exhibiting 1 or 2 red flags, does that necessarily mean that they have autism spectrum disorder?
Absolutely not. So we're looking for a pretty comprehensive evaluation to determine if a child has autism spectrum disorder or not. Although it is determined based on behavioral observations, it's not a single behavior that we're looking for. It's kind of a constellation of multiple differences, as I mentioned, both in social communication and in behavior. But I think it's important to recognize that all children in early development might exhibit some of these behaviors, and it can be within normal limits. So my daughter, I remember when she was a baby, flapped her hands when she was excited about something. And I kind of had that moment of, oh gosh, is this something, I need to be concerned about? But it turned out that looking at some of the other areas of her development, we saw that there weren't enough differences across those domains.
Wonderful. Thank you for that. And if a parent has a concern that their child might have autism spectrum disorder, who should they talk to?
So I think definitely anytime a parent has concerns, it's important to seek some additional support and information. Typically, the first step would be just checking in with your pediatrician. Most of the time, children go in for those well visits at routine stages, and typically the pediatrician will administer some screeners during each one of those well visits. I think it's important to add information if there's something in that screener that, or some of these red flags that we've talked about, to share with your pediatrician some things that you might be concerned about or seeing outside of that office visit.
How early can a parent request a child be evaluated for autism spectrum disorder?
So we actually know that a child can be reliably diagnosed as early as 15 months of age. Many times specialists will be a little hesitant to diagnose that early and may talk with a parent if they're seeing some risk factors, if they're seeing some of those red flags, and look for continued monitoring and maybe have them come back more frequently. But usually, if the pediatrician is in agreement that there's some concerns, there'll be a referral for a comprehensive evaluation by a neurologist, a developmental pediatrician, or a psychologist. Additionally, families can also seek an evaluation through the Florida Early Intervention Program, Early Steps, and that doesn't require a referral.
And how is autism spectrum disorder classified?
So the current diagnostic manual, the DSM-5, classifies autism spectrum disorder based on 3 levels. In the past, we used to look at autism including 3 distinct diagnoses, which were autistic disorder, Asperger syndrome, and pervasive developmental disorder not otherwise specified. But in recent years, we've shifted over to looking at autism truly being a spectrum and not having that distinct separation. So we have 3 levels with differences based on the level of support the individual requires.
And is there a cure for autism spectrum disorder?
Currently, there's no known cure. However, there are a lot of interventions available, and we know that individuals with autism spectrum disorder have endless potential. So there's absolutely capacity to learn, gain new skills, develop coping mechanisms for different challenges. And so there's no ceiling to what we can reach.
And are there alternative treatments for parents who do not think medication is the best fit for their child?
Absolutely. So as a matter of fact, currently there's no FDA approved medication specifically for autism spectrum disorder. There are individuals with autism who are on medication, but the medications that are being prescribed are specifically to treat different symptoms. So it's not necessarily a medication for autism, but rather a medication to treat hyperactivity or to support improved attention and focus, or to address sleep concerns or other behavioral agitation, things like that. So it's definitely a personal decision that
Mhm.
parents would speak with their psychiatrist or developmental pediatrician about those options. But outside of medication, there are a variety of evidence-based interventions, including applied behavior analysis or ABA,
Mhm.
speech and language intervention, speech therapy by a speech and language pathologist, occupational therapy, and sometimes physical therapy.
Okay, great. And for parents that have a child that's been recently diagnosed with autism spectrum disorder, what do you think are what do they do once they have the diagnosis? What are the first steps after that diagnosis?
So it can be really overwhelming to hear that diagnosis for the first time, and can come with a lot of stigma and concern and confusion as to what comes next. And part of why CARD came into existence was because parents asked for support in being able to navigate the resources. We know that the intervention journey is going to be unique and different for every single family. That intervention should be individualized based on the child's needs. So, usually, a family, when they leave that diagnostic appointment, will leave with quite a stack of papers. It should include some intervention recommendations and referrals. And a family's first step should be connecting with CARD. You'll register with CARD, it's completely free, and we can help by connecting you with an autism disorder specialist who will meet with your family, learn a little bit more about your specific case, and help guide you in navigating the resources, prioritizing those interventions, and connecting with providers locally.
Amazing. And what services would a child be eligible for once they do receive an ESD diagnosis? You did go into that a little bit.
Yes, so it's going to be a little bit different based on each person's insurance coverage. However, once they receive that medical diagnosis, typically insurance will cover things like applied behavior analysis or ABA. That would usually be through a referral from the doctor. May also include speech therapy, occupational therapy. Child may receive educational interventions as well. They may be eligible for special education services through the school system.
Okay, great. And then what are the benefits of early intervention for children who have autism spectrum disorder and other developmental disabilities?
So I think one of the most beautiful things about the brain is that we have what's called neuroplasticity. And that's the ability for our cells to grow and change and make new connections, new neural pathways. And this occurs through our interactions with the environment and interactions with others. So, through early intervention, we can ensure that children are having lots of different experiences in their environment, that they're being exposed to a variety of new learning opportunities and skills, and that they have chances, additional chances to practice their social communication and their interactions with others. We know that outcomes are absolutely improved when intervention occurs earlier. There's a lot of research to support that when intervention begins by age 3, outcomes are improved compared to when intervention begins after age 5.
Right. And can you go a little bit more into detail about what specific services UCF Card provides? How can you help families who are diagnosed, have a child diagnosed with autism spectrum disorder?
So, in addition to the individualized consultation that I described before, where you'll have a chance to connect with an autism disorder specialist, there's also opportunities to engage in our community. We have multiple opportunities to participate in support groups for parents. We have specific support groups for Spanish speaking families. We have support groups for fathers. We have support group for parents of very young children, as well as parents of adults or parents of teens in transition. Something unique about CARD is that we do support individuals across the entire age span. So there's no expiration. It's not just early intervention, but we continue to support the family and that individual throughout their entire lives. We also host regular parent education seminars or trainings for parents so that you can learn more about some of these intervention approaches and those evidence-based strategies that can support your child's learning.
Wonderful. Wonderful. Thank you so much for that. Is there any other additional information you wanted to share with families out there that these questions didn't necessarily cover? Anything else you wanted to talk about?
I think I mentioned initially that sometimes there's some stigma with the diagnosis and some fear associated with it. I think that one of the most important things is that that label, that diagnosis, ultimately is a tool to help describe what some of the needs currently are. And that helps open the door to accessing resources, accessing some of those interventions. Nobody has any idea what your child's going to look like a year from now, or 5 years from now, or 15 years from now. We don't have that crystal ball. But what we do know is that the more support that we can put in place early on and along the way, that journey is just going to go up.
Wonderful. Thank you so much, Dr. Salazar, for taking time out to really speak with us and go over this important information for our families. If you need to reach out to Help Me Grow. If you need help with connecting with UCF Card, it's a wonderful program. It's a wonderful service for families that is out there. Just call 211, ask for Help Me Grow. Thank you so much. Thank you, Dr. Salazar.
Thank you for having me. Take care.